The ACL, short for Anterior Cruciate Ligament, is anatomically located in the front of your knees and plays an important part in attaching the shin bone, known as the tibia, to the thigh bone, known as the femur. Alongside the PCL, short for Posterior Cruciate Ligament, they form an X in your knees, crossing each other, and permit knee flexion. In quick changes of direction, that is extremely common in high intensity football matches, the ACL often tears. These tears can be classified into three intervals. Grade 1, a small stretch with only slight damage. Grade 2, a slight tear due to a harsh stretch. And Grade 3, a complete rupture, unable to maintain stability near the joint. Since the ACL is a ligament, it can't directly be strengthened to prevent injury. However, there are steps that can be followed to reduce chances of injury by strengthening its agonist and antagonist muscle regions, redirecting the stress from the ligament. In the case of knee flexion, the hamstrings act as the agonist while the quadriceps act as the antagonist. Exercises for the hamstrings include the Russian baby maker, tank squats, and downward dog twists, amongst many others. Meanwhile, exercise for the quadriceps includes squats, long arc quads, and Bulgarian split squats. In addition, some golden rules when preventing all injuries, no matter the kind, include indulging in appropriate warm-ups and cool-downs, maintaining a balanced lifestyle, and listening to your body. Primarily, your warm-up routine should always take between 7 to 10 minutes, including dynamic stretches to activate the muscles, preparing them for mobility and movement in quick changes of direction. Your cooldowns are also as important, acting as the first step in rest and recovery to prevent chronic injuries. This should entail static stretches along with foam rolling on muscle regions for between 10 to 15 minutes. Secondly, the importance of lifestyle balance that includes your diet and sleep cycle cannot be overstated. As a footballer, it is imperative that a post-match meal rich in proteins should be consumed within 40 minutes after every match or training session, recovering all the electrolytes lost when in action. Further, alongside amino acids, your meals must also contain sources of nutrients like carbohydrates and lipids. Meanwhile, you should ideally get around 7 to 8 hours of sleep per night at a minimum to rest your body. Finally, the most important factor in preventing all injuries is to listen to your body. If you feel any pain or discomfort for more than 5 to 7 days, no matter the intensity, it is always best to get it checked by a professional such that the risk of it being chronic can be eliminated. Your body always talks to you, so when it is good to push yourselves a bit over the limit to grow as an athlete, you must listen to your body and not overload it.